Hi, I'm Desmond Howard. I'm here in support of the sports marketing agency and its community partners, Therapeutics and the Oakland Community Health Network. Our goal is to amplify their mission around controlled substance management and champion frontline workers in the mental health and substance use disorder space. Today I'm joined by Christina Nicholas, who's the Director of Substance Use Prevention and Treatment Services for the Oakland Community Health Network, and also Dwayne Goldsmith, COO and co-founder of Therapeutics. Thank you guys for joining me today.
Thank you.
Christina, I would like to start with you. Now, we're in a world where we like to celebrate first responders, but for some odd reason, your organization and the providers that you serve are not really considered first responders. What is your role, and why should you guys be thought of as first responders?
Well, thank you for that question. Oakland Community Health Network is the public mental health system for Oakland County, Michigan. And we service, through our network of over 300 service providers, about 23,000 individuals a year. And these are individuals with intellectual developmental disabilities, mental health challenges, and substance use disorders. And I can say that absolutely our contractors and many of our staff members are absolutely first responders. From the moment the pandemic hit, they have not stopped working. They are there on the front lines servicing some of the most vulnerable individuals in our community and have continued to do so through illness and through fear and through putting their families at risk to ensure that these citizens receive the services that they need.
Christina, thank you and your team for your services. I really appreciate what you guys do for the community. Dwayne, I'd like to ask you a quick question about the system you guys have developed now. So it has a tremendous impact on the opioid crisis in America. Tell me more about this system you guys developed.
Thanks, Desmond. The system that we've developed is under the category of controlled substance management technology. And it's a combination of cloud-based software and also devices that are in the classification of Internet of Things devices. And what that essentially means is that we've created a system that helps consumers use the medication that they've been described in a way that they don't get to take more than they should, and they also get to take it at a particular time of day. So we've actually found a way to kind of reconceptualize the delivery chain for controlled substance management elements, whereas we can actually help the consumer consume the medication in a more controlled manner. Now we've actually done testing in our own facility, our own clinic, but our real impact is to be able to target the 70 to 80,000 individuals that die every year from an opioid or another substance overdose. So we're looking to make an impact in the tune of 15 to 20% of that number.
I don't think a lot of people recognize the fact that overdose is the #1 cause of accidental death over traffic crashes, over any other type of accidental death. 83,000 people in America died of overdose in 2020, the highest rate that we've had, showing the pandemic has had significant impacts. Where we were going in the direction of decreasing overdose deaths, we have shot up to the largest amount. The University of Michigan Injury Prevention Center, in Michigan alone last year, we had over 2,000 deaths due to overdose, and over 15,000 administrations of naloxone, which is the overdose reversal drug when someone is dying of an overdose. So it is very real.
So I'm glad you mentioned that. And so you're on board with Therapeutics and what they're able to do, correct?
Well, certainly we're on board with Therapeutics. They're a contracted provider of ours, and we only contract with the best. And certainly Therapeutics is among those. But also the device, 100% we are behind the device. I think it can be a game changer for people and their treatment of opiate use disorders. I think it can change everything from the federal level to the state level to have a device such as this.
Dwayne, Christina, you guys have been excellent. Is there anything else that you would like to share with our audience?
If you or someone you love is experiencing a mental health or substance use crisis, please call Oakland Community Health Network's Resource and Crisis Center through Common Ground at 1-800-231-1127. Or if you would like to access services, please contact our non-emergency access line at 248-464-6363, and someone is available to help.